This is my wound care video. So, I would knock. Hi, my name is Ashley. I'll be your nursing student today. I'm here to pack your wound and make sure it looks good and assess it for you. Can I get your name and date of birth? Jean Holland, date of birth is 7/20/1950. Do you have any allergies? It looks like just penicillin here is on the wristband. Okay. Can you tell me if you have any pain on a scale from 1 to 10, 10 being the worst, 1 being no pain at all? They would tell me what kind of pain they have. Okay, so I'm going to assess, I'm going to do the wound care right now. So I'm going to pull these back, maintaining their privacy. So we pull this up. Okay. I do hand hygiene. There's none in there. I do hand hygiene. Put some gloves on. And I do have a trash can down here. So I slowly peel this off. Try not to pull at the skin. And it seems with the last time that it was changed, I cannot read that. What does that say? I don't know. That I can't read that, but I'm going to assume that it's 2 o'clock. Okay, so 1600 or 1400. Pulling back 1 layer at a time. Oh, they double typed it. Okay. Pulling back 1 layer at a time. I would assess for any drainage of any type. I don't see any. Going slowly, keep pulling back. I would take this piece out, pull it out. Over the trash can, I'd assess if it had any drainage or anything like that, noting the color, odor, anything. Putting it in the trash, and then I do my reader examination. There's no redness. It doesn't look like there's any edema, no ecchymosis or anything like that. No. If there was drainage, I'd note the drainage, color, amount, odor, if it had any. And then approximation, there's not going to be any approximation for this. So I would take my gloves off, and now we're going to get started on the actual wound care. Hand hygiene again. Open my package. Going to take the caps off these for now. Yeah, I know the label is on the top. Making sure I don't touch anything in the sterile field. I'm going to grab my gloves really quickly up here. I'm going to take this, dump it, just like that. Take this, dump what I can into the trash, label up, and then go in here. Here and put my gloves on. it's sterile. Okay. There you go. And come back over here. I'm gonna keep my hands up here. I'm gonna do that. What I need those. I need the gauze. I'm actually gonna put the three pieces of gauze in there. If I wasn't using the gauze, I would use these. It's the 3. 2. I don't need that. I need this. I'm going to take my knife bar. I'm going to set that over here. I'm gonna get my the packing bag stuff. I'll take these out. Slowly pull it in. I don't want to touch the sides. I'm gonna put it in there. And then what I would do next is I'm gonna wash it or clean it. Take these out. I don't want too much food in them. Making sure that I don't touch the patient. And I make sure I don't do that. It's gonna start at the front, go around. Do the same thing with the next two. I'm gonna squeeze this one out a little more. Making sure I don't touch it. I'm gonna go out a little farther this time. Okay, throw it away. And the last one. Doing the same thing, going out a little farther. If there was more drainage, I'd wipe again. Making sure that I clean all of it out because it may take more than just 3. After this, I would pack it. So I take it and pull it out. I don't want it too wet. Okay. I'm going to take one of my swabs, sort of pull it up like this. So when I put it in, I want to make sure I don't touch any of the sides. Just go straight in. Go far. Kind of go the opposite way and pull it out and just kind of push it in. Don't want to pack it too tightly because then it can make it worse. When I finish, just right at the top of the wound, throw it away. Next, I would take 2 or 3 pieces of gauze, and this I'll use 2 because there's not really that much drainage, it looks. Making sure to keep the inside sterile but clean, put it in. Glue side up a little bit and put it on top. Take my tape. I'm going to tape 3 sides down. Making sure to be careful for down here because I don't want to pull any hair if I have any. Leaving one side open so that way it doesn't get too moist to make it worse. sign and date it. Put it on the back of my glove. And I do have a pen. I did not put up here. Alright. My name, the date is 10/22
14/28.
2020, and it is 14/28. And this is a permanent marker, but even then it still isn't quite so bright. Should I take it? Not putting it on them. I want to make sure that I don't do that. I'm just going to put it where they can see it. Right there. Then I pack up, obviously still using Chill Technique. And put that in there. I dump everything out and throw everything away. And then I come over here, obviously, and pick up my bag. I'd ask if they had any more pain or anything like that, making sure they were comfortable. If they needed anything else, obviously giving them a call light, turning on the TV, whatever they needed. And then I throw all my contaminants in here, in the biohazard. Things are probably going to change. I think I might have assessed a little more, would have assessed the area, maybe look at it a little more deeper if I could have. Oh, I did not hand hygiene when I walked in the room. So that was one thing that I didn't do.